Thank you very much. Welcome one, welcome all. So thank you all for being here. Thank you for your investment. We're expecting others to join us. Looking forward to a conversation um, uh, that is really about taking everything that we've talked about to date and applying it kind of in the sense of how we might be able to produce population level change. And kind of what does the science really tell us about that? And so welcome to Principles of the Environmental Approach for those of us working in the prevention workforce. My name is Carlton Hall. I'm ecstatic to be here and to be working with our extraordinary partners there at the Kids Department there in Delaware, and each and every one of you who have been with us for this journey. If you don't mind, go ahead and introduce yourself in the chat. It helps me, it helps Dave as we engage with you in the conversation to be able to align not only your name but your name with the organization that you work with. So please go ahead and do that, and we look forward to engaging with you in the chat throughout the day. Throughout the day, we are going to kind of break so that we can have conversations with you. We want this to be as interactive as possible. Most importantly about that is it's really about ensuring that this training provides you with what you need out of it, right? And so we're speaking to a variety of experiences here, and many of you are coming with your own needs and your own questions, and we want to make sure that we're able to have an opportunity to learn with and from each other. So every once in a while, we may stop the PowerPoint, ask everyone to come on screen, and to be able to kind of engage that way. And there's a few enough number of us that we should be able to do that and do that well. So I hope that you're able to do that. Hope that you join us and engage with us in the chat. But I want to get started with a little bit of a question. And Dave, I want to ask you, if you don't mind, to monitor the chat. In the chat, what I want to do is I want you to answer this question. If your dog has fleas, what could you do? What could you do? Just place that in the chat. Just going to give about 30 seconds. What would you do if your dog had fleas? And Shavel, if you begin to see them populate, go ahead and share.
Yeah, Christine says bathe them. If they have multiple dogs, we could give them a bath.
Good deal.
Flea bath, take them to the vet, get a prescription for fleas. Thank you, Caitlin.
Got it, Caitlin. Yeah, excellent. Anything else?
We did this once before, and someone said, get a new dog. And I don't know if that's the response we want to do. That's throwing the baby out with the bathwater, but
right. You know what? But that's funny. You're exactly right. And most of you are thinking in the way and in terms of how we're looking at it. Absolutely, you could
gain free prevention medicine from the vet.
You can get you can get medication and the like. But what about, hold on a second, sorry. What would happen though if you put the dog back into a dog house that had fleas, right? And so which one of these strategies would you now do, right? And you can come off mute if you'd like to do that. I think what it is that we're trying to share is that if you did both strategies, both bathing, providing medication, but also treated the environment in which the issue and the challenge was really found in the source of that. If you didn't take care of the environment, you wouldn't be taking care of the issue. And so in a very real sense, much of our conversation is going to be built upon that foundational concept, right? And so there's a lot of this foundation that's going to be found within all of the work that we do in public health, particularly as it relates to substance misuse prevention. And Dave Shavel is really going to drive this train today. We're going to engage with you all throughout this conversation and all of this. And so he's going to talk about a number of these concepts with us and then explore how we might be able to apply specific strategies as it relates to a lot of this conversation. I need to take a moment to share with you that this webinar is indeed being recorded, and that if we're expressing views, those views don't necessarily represent the views, policies, and positions of SAMHSA or any of the other institutions or agencies that may be funding us to be able to do this. I've been extraordinarily blessed to be able to work with this amazing group of thinkers to be able to help create and produce this series, and we thank you for joining us. Dorothy Cheney is having a well-deserved rest right now, and so you're stuck with Dave and me today, so let's just share that, and we're going to go ahead and have that conversation. This is the fourth in our series, and we're looking forward to coming back on the 22nd, and that will be the last in this particular series, this foundational training series that we've provided for everyone. And that will be focused on sustainability. We've asked that you give some real consideration to inviting others to that particular training so that we might be able to have an extraordinary conversation. We know that is heavily on the minds of many of you there in the state. So we're looking forward to doing this today. Here's what we're going to discuss. We're going to talk about environmental strategies and why they're important, understanding those concepts, and the need for us to be attentive to population level change. What does that mean? We're going to talk about some evidence-based environmental strategies, right? That will be able to address those specific community conditions that we're trying to address, and look at the strategic prevention framework and how that's used in order to help us to be able to identify environmentally based strategies. All of this is through learning with and from each other. Here is the agenda. Throughout this agenda, we're going to be breaking for conversations and discussions with each other so that we can bring out the learning that's really necessary. And so please come with your questions. We're going to be able to address that. Dave Shavel has had inordinate experience working in the field of prevention and working with systems across our nation, applying these very same tools. And so you are in great hands today to be able to do this. We're going to be careful about the words that we use, understanding that our words have real meaning and weight. And so therefore we're conscious of making sure that we're paying attention to the jargon that we are using, expressing. If there's any need for us to clarify anything, please stop us and let us know that as we go through this. And so what I'm going to do is I'm actually going to stop sharing my screen right now and bring it up for Dave so that he might be able to take us forward with this conversation. Looking forward to it. You all are looking forward to the conversation. Bring your questions, bring your thoughts to this.
Thank you, Carlton. We were talking when we came on earlier about all the sports that are occurring in the Philadelphia, Delaware area. And you think about it, the Phillies were on, the Eagles were on, I don't even know the name of the Major League Soccer team that was in the men's finals, the Northwest Soccer League. And I was trying to think of an analogy for individual and environmental strategies. And basically think about it just an atmosphere. When you're in your home watching TV, you're watching as an individual. When you're at the game and you're celebrating with everybody, you're watching in that bigger environment. Because made me think about that. Carlton talked about population.
That's level. A very good try. Great. That was good. That was good. You tried to pull it. You tried to pull it in.
But when Carlton mentioned population level change and community level change, that's really when we talk about that, that's why we talk about doing environmental strategies. Because when you're talking to individuals, when you're providing education, Those are necessary. Those are what we need to do so we can get individual level change, so we can make a difference in individual lives. When we talk about environmental strategies, just before we go in to talk about any specific definitions, et cetera, we're talking about how do we change an entire community? How do we change, however we define that, whether it's a neighborhood, whether it's a county, whether it's a country, whether it's a state. We're talking about changing the conditions and changing the environment for everybody in that community. So that's one way of thinking about what we're going to be talking about today. So I will share my screen if I am able. And are you seeing my screen?
Almost. Yes, we are.
Okay. Again, the purpose of this training is what is an environmental approach to prevention. But the way you described it, Carlton, it's really what we're talking about today. What are individual and environmental approaches to prevention? Because what we're going to talk about today and what we're going to discuss and see in our examples, it's really about doing both individual and environmental strategies, because that's what it's going to take to achieve behavior change and behavior change among individuals. And when we bring that change to individuals, when we do it on a community-wide basis, on a population-wide basis, then we're talking about doing environmental strategies. And so, and another example of that is we can give everybody a toothbrush and toothpaste. And so that's going to change for everybody as an individual, how they brush their teeth. They may or may not use the toothbrush. They may or may not brush their teeth. However, if we put fluoride in the water, that changes it for everybody, because anybody who drinks water will be exposed to that fluoride. So that's an environmental strategy. The overall behavior change is to improve the health and quality of our teeth. That's going to achieve population level change. We need both those individual strategies and environmental strategies. And so that's the theme for today. And I'll just ask, I think it was Dana was talking about, she had some questions, and her questions was, how do funders define it, and how do people define strategies? We are going to go through today and look at a lot of examples of what are individual, what are environmental strategies. And yes, there is a little bit of, I'll say, some ambiguity with some strategies, whether they're individual and environmental. And we're going to see it matters how they're applied. And so we can look through that. And I'll just ask now, before we move into the actual PowerPoint, are there any questions that you make sure you want to have answered about environmental strategies? And Dana, you may want to expand upon your question to make sure we do answer it today, or at least provide you with resources that will allow us to answer that question. Do you have any just specific questions over maybe if a specific strategy is individual or environmental, or just what questions do you have around environmental strategies? Anybody?
Yeah, so I'm one of the evaluators for the block grant prevention project. And some of the things that come up are things like deter a bag. So that's an environmental strategy under some definitions, because it provides, it's like I'm having a hard time understanding it, but because it's reaching like maybe only 10 people, you distribute only 10. Do you still call it an environmental strategy? Even though it's like often classified that at the federal level if it's only reaching 10 people. So that's like one of those issues that comes up. Another issue, the big one that comes up often, is people want to do like a billboard. In the past, it used to be called environmental strategies, but now we know that to be information dissemination. But sometimes there's still some conflicts around that piece. Things like again, the same issue of responsible beverage server training. You might you might be providing that training to 10 people. What's the reach when it comes to population? So there's a lot of questions, and I think we resolved most of them, but I think it's just something that's a little bit messier. And so that's why I wanted to hear from additional people who have expertise, just to, expand my own knowledge of the topic.
Thank you, Dana. And we will cover that. And please, when we get to those sections, please, I'll say challenge and provide other examples as we go through this, because that is important. And yes, we do have responses for each of those. So thank you for those examples. Anybody else? Thank you, Dana. Anybody else have any just questions, any driving information you want to learn about? Again, we're talking about community-wide, community level, population level behavior change. Okay, great. I just want to start out with the chat box poll if we can. And think about your organization. And we built this list from various places, trying to cover a range of prevention activities. And just think of your organization. And you can put put in as many as apply, whether your organization, put an A down if you provide education and services to young people. If you support parent and families, put a B. If you advocate for equity and social services in the criminal justice, would be C. D, provide assessment counseling. NIA, solve which one to put, all of the above. E, have developed strategies, decrease the spread of disease, or other. Just which of these apply to your organization?
And David, for me, actually, it would be helpful if I knew what, because a lot of folks, a lot of organizations are going to be focused on a lot of these, I'm sure, for various things. But would you, if you all were to be able to align with one or kind of lean into one as primary, one or two as primary, which would you say is your primary kind of role in your organization? And so I would go back to Naya and others to say if are there those that would be primary. Thank you, Becca. Thank you, Esther. Thank you, Lisa. Got it. Dave, are you seeing them? I can read them out.
I am. And so one of the reasons, one was to see what you're doing. And then the second is, as we go through this, we'll be able to, and this gets to Dana's questions, and see whether these are individual and or environmental strategies as we go through these. And I think the answer is going to be, for a lot of cases, it depends on how the strategies are applied. And again, how they're applied and what is the frame that they're applied in will determine whether they're individual or environmental strategies. So when we look, would anybody, before we get to the slide, would anybody like to put and be brave enough to put your own definition of what is an environmental strategies is, before I go to the next slide?
Well, you can raise your hand because I know it takes time to type.
Yeah, or if you do, you can either shout it out, or if you're a fast typer, you can type it in there. Anybody like to put your definition of what is an environmental strategy? And, yeah. Okay, well then you're stuck with our definition. And when we look at our definition, this is provided by SAMHSA, Substance Abuse Mental Health Services Administration. It's prevention efforts aimed at changing or influencing community conditions, norms and standards, institution structures and systems, and policies that contribute to substance use and its consequences. Now, Carlton, you made a jargon alert. I think this violates every rule of our jargon alert, because it does have environmental strategies are like finding the thermostats in our community. What do you mean by that, Carlton?
So for me, it's kind of, you know, if I wanted to affect folks individually, I might, you know, buy coats or give everybody an electric blanket or whatever. But if I wanted to affect everyone in the home, I would just simply go to the thermostat and change the thermostat. And so for me, when I think of environmental strategies, I think of them like they're the thermostats for our community. If we can kind of look at what strategies could actually have that kind of impact, that kind of effect.
And these strategies affect these things here. So for example, if we're talking about community conditions, remember back when the methamphetamine first hit and there were a lot of meth labs and people were buying all the cough medicine in which to make, what did we do? Anybody remember what one of the big strategies was to address that meth when people were, again, first understanding how meth was being manufactured? Anybody remember what the strategy was? Is they put cough syrup.
Didn't we put cough syrup behind
the counter? Or now they lock up the cough syrup and you have to go get an employee to unlock it. So that changed the community condition around how people are getting access to the precursors to the methamphetamine manufacturer. You think about putting tobacco products, when they made that, put that behind the counter, and now you have to ask someone to buy tobacco products. That's changing the condition in the community. If you think about policies and laws around advertising, when they say that how much advertising can we have in a sign, or zoning around where we can put, in Portland here, marijuana dispensaries. That's changing the conditions in a community. And when we do that, we're changing it for everybody in the community. If you think about norms and standards, this is a little bit more obtuse, but if you think about, I'm going to give an example of Mardi Gras in New Orleans. There are some communities that said, we think there's too much alcohol, so they have alcohol-free Mardi Gras. That's changing the norm around how we celebrate. There are some communities that looked at quinceañeras and bar mitzvahs, and that's when you were being exposed to alcohol use. The youth may or may not be drinking there, but they're exposed to excessive alcohol use among the family members, or tailgating at a football game. When we put in policies that change how we can celebrate and what is the use of alcohol around the celebration, that's changing the norms and standards within a community. When we think about institution structures and systems, when we talk about how we require, and we'll talk about this, retailers to, in order to get their license or renew their alcohol or tobacco license, they have to undergo responsible beverage server training, then that's changing how they go about getting their license, but that's addressing the condition of selling alcohol and tobacco products to minors. When we talk about how school policies and how they deal with youth who are in violation of those school policies, whether they get expelled from school or whether they get an Asperger's screening for brief intervention for referral or treatment. If we build that into our systems about how we treat that, that changes it for everybody that attending that school system. And finally, when we talk about policies, whether it's laws or whether it's the policies of the Elks Club or the Lions Club about how they treat their alcohol, or at the county fair, how alcohol is being served. When we do and we change these policies, it impacts everybody that's impacted by the policy. So one way, just a good litmus test, if I can use that term, about when we're deciding whether something is an individual or environmental strategy, if it changes conditions, if it changes the norms for everybody within the community, if it changes how an institution or an organization or a system treats everybody, or policies, how they impact everybody, then we're starting to talk about environmental strategies. Any just questions about this? It's nice to unpack this and this definition, because it talks about all the things that we change with our environmental strategies.
I love this because one of the things that is really helpful when you unpack a definition like this, we're able to then apply some of those questions that may be in the gray area that Dana brought up, and bring those questions directly to this definition and how we apply it. Are we changing the way the institution's doing something if we're providing terror bags to everyone? Or are we just providing 10 terror bags out there and trying to call that an environmental strategy? That's, it helps us to become clear about the ways in which we think about the strategies that we're implementing.
Yeah, and when we'll follow up on that, there's lots of good examples around that. Thank you. And Dion's bringing up underage drinking on college campuses. When we change, I'm just thinking whether it's, it can be, there's some negative environmental strategies. I used to live in Wyoming, and the University of Wyoming recently allowed alcohol to be served at their football games. That's an environmental strategy that increased the exposure to alcohol. So that was in some sense a negative environmental strategy. But when we do the opposite, when we restrict alcohol on campus, when we make sure that all our servers and all our events that do have alcohol, they do have some sort of screening where they check IDs, then that is responsible for making it harder for everybody on that campus to get it. And then some states are again, we do have a conflict in policy, and Dion, if you want to talk more about that, some states, Oregon, Washington here, were the first states that legalized marijuana, yet at the federal level, we still have marijuana as a Schedule I drug, so it's illegal at a federal level. That's where we have a conflict on what are the laws around marijuana. So again, that is the policies that are in place, well, when we look at the norms that are associated with that, we see a conflict in norms. So it's up to us to look at what are the conditions in our community. And that's what we, when we go through our agenda here, we'll talk about using the strategic prevention framework to say, what are the conditions in our community and how do we address those conditions with both individual and environmental strategies? Good, good. This is the exact conversation we wanted to have. So when we go back to our questions about these different types of strategies and you were looking at them, the answer can be some of these are going to be individual, some of these are going to be clearly environmental, some of these can be both individual and environmental. So again, we'll go into this, but part of it is providing education and services to young people. If a school district is providing a curriculum, and just as one example, and they're providing, say, you know, botkin life skills training.
Yes.
Life skills training. If they're providing them, that's an individual strategy. Even if we're providing it to all fifth graders, it's still an individual strategy. However, if the school district puts it into their school policy that they are always going to provide botkin life skills training to all fifth graders forever, and they're going to put it in their budget, that it's always going to be budgeted, meaning teachers are going to be trained, we're going to be providing the materials for every fifth grader that goes through for perpetuity, then it becomes an environmental strategy because it's written in the policy. So for a lot of these, they may be individual focused, but if we embed them in policy, if we include them in a way that is going to be affecting people for on an entire population on an ongoing basis, then it moves it into an environmental strategy approach. So we can look at all of these and we can start to say, again, support parents and families, the same thing. If we're providing services to family, however, if those services are part of an institution, whether it's Department of Health and Family Services, their Child Protective Services, whatever, if they have it written into their policies, we'll talk a little bit about big P and little p policies. If they have some of these strategies written into their policies, so it's going to be continuing on an ongoing basis, then we can start to look at those environmental strategies because they're impacting everybody within the community. So this is a very long way to say, in deciding whether something is individual or environmental, we can look at how it's implemented in the context to decide whether it's individual or environmental strategy. So Carlton talked about the public health approach and the environment and the need to do community-wide strategies. If you remember from our previous trainings, we talked about the river story. And so if you looked on the left side of the river here, we see some youth who have fallen into the river. And so being good preventionists, we want to walk upstream and find out, we want to treat those youth. We want to save those youth that are falling downstream. But we also want to walk upriver. Dion talked about earlier when we talked about the dog and find out how the fleas got in the doghouse in the first place. We want to walk upriver and find out how the youth are falling into the river in the first place. And if we look on the right-hand side of our picture here, we see there's a bridge and people are falling into the river. So we could teach individuals how to walk around the break in the bridge. We could teach individuals to swim. Those are individual strategies. So we're teaching individuals, we're giving them knowledge, we're giving them skills so that if they fall in the river, they can swim to the shore. Those are individual strategies. If we fix the bridge or if we put guardrails on the bridge, that changes the environment for everybody that walks across that bridge. In that case, it's an environmental strategy. If we put a net underneath the bridge, so anybody that falls in, that falls through the crack, if that's the case, and falls into the net, that's an environmental strategy because it impacts everybody. So again, in walking upstream, we can do individual strategies, provide, again, skills, knowledge to individuals. We can do environmental strategies, fixing the bridge that fixes it for everybody. And so Carlton talked about the public health approach. And if you remember from our previous trainings, we talked about the public health approach or the epidemiological triangle where the agent, the host environment. We talked about, we do work in our communities where the agent, in the environment where the agent and the host come together. So the agent and the host in our dog and house and flea example, they came together in the doghouse. So again, the dog got the fleas from the doghouse. So the agent in that case was the flea, the host is the dog, the environment is the doghouse. We can do things to the dog. We can give them a bath. We can give her a bath. We can give them medicine. We could try to get rid of the fleas, but not until we change the doghouse and the environment that they're living in, that we are changing that condition. So we can talk about the public health approach and some of the examples that Carlton talked about. We did individual and environmental strategies addressing our dog. When we talk about if, and this is an example we used previously, if there's cocaine being sold at a neighborhood bar, and I'll just ask you again, what are some of the things we can do to address the situation? You can either shout those out or put those in the chat box. If we have, again, the bars are legal, and if the bar may be doing a good job of not letting people under 21-year-old in, but still if there's cocaine being sold at the bar, what are some of the strategies we can put in place? We could have a police presence. Thank you, Dana. And that police presence could be, and again, when the police are making their rounds and they're starting to, again, go by that bar or those bars where the cocaine is being sold more often, put signage in the bar that it's a drug-free space to let people know that, again, we don't want illegal drug activities going on. Here, it may be a dangerous situation. We want to warn you about that. So that's providing more information. And so as you can see, these strategies are in some sense individual. If we put up a sign, that's educating individuals. If we are starting to inform parents about it or start talking to even the retailers, letting the bar owners themselves know that these activities are occurring, those can be individual strategies. If the police write it into their policy that they are going to be always patrolling the bar and they allocate resources to that area of town where that bar is, and they make it a policy decision, then we're starting to move into environmental strategies, because that impacts every police that comes on duty. It impacts every bar in that area because the police are making it a regular practice because it's embedded in their policy to go check those bars. Then it becomes an environmental strategy because it's going on an ongoing basis and it impacts everybody that attends those bars in that area. Then we're talking about environmental strategies when it's embedded in policy. Drug checkpoints in an area. Those, again, those are strategies that impact individuals because those individuals that go through the checkpoint. However, if we make it a policy that we're always going to do these checkpoints on Friday nights, on Saturday nights in these areas, and we put resources behind it, then it's becoming environmental strategy because we're changing the institutions and policies around how we treat that situation where the agent, the host, and the environment come together. Again, when we work with the, thank you, Dion, and if you want to expand upon this, we partner with the DEA, the Drug Enforcement and Tobacco, the DATE, which is the DATE, Drug, Alcohol, and Tobacco Enforcement folks. If we work with them and we form, it may be just information sharing. That's not necessarily environmental strategy, but if we sign an MOU, we put it into policy that the DATE group will do one thing, local law enforcement, the bar owners will do another thing. If we write those up as a memorandum of understanding and we create policy around that, then we've changed our institutions in how they're addressing this situation where the agent, the host, and the environment come together. So
Hey, I don't know about everybody else, but I think I'm beginning to hear a little bit of a pattern.
I was hoping someone would notice that. Thank you, Carlton.
So
What is that?
a policy and resources. Policy and resources, I keep hearing you refer to over and over again.
And so again, as we're going to walk through examples here, and keep in mind when we look at these examples.
Go ahead.
Okay, I thought I heard someone saying, when we look at the examples, we can start to look at how something that is an individual strategy could be made into an environmental strategy. I'm going back to our definition from SAMHSA here. If we're impacting the community condition, norms, standards, institutions, structures, and policies that contribute to substance use and its consequences. Or we could say that prevent substance use and its consequences. So again, when we start talking about changing, and we'll look at some further definitions of individual environmental strategies that really talk to changing these aspects of our community. And think about COVID. Again, you used this example as a public health approach. There were some individual strategies that were put in place. Wearing a mask is an individual strategy. Washing hands, standing 6 feet apart, those are individual strategies. They become environmental when they become mandated. So when we were mandated to wear masks in certain situations, in certain environments, when stores put up the dots, and they're still on the, I still see them when I go into stores, the dots where you're standing in line to go to the cash register. That was an environmental strategy within that store because it was a store policy. They wanted people to stand 6 feet apart. It changed the environment, the condition where people were being exposed to COVID. So again, it's how these policies are applied start to dictate whether it's an individual or an environmental strategy. So just if we can get you to think about this, and another way of looking at this, how does the public policy, this is a little twist, but how does, if you were to complete the sentence, the public health model informs my work because it, and think about how we apply individual and environmental strategies to address the public health approach in your own individual work.
And folks, as I shared with you earlier today, I'm going to actually be more proactive in calling on some folks. So if you don't mind, I'm going to call on a couple of you if you could kind of think about this. Don't worry, there's no bad answer or horrible answer or anything of that nature. This is all about us learning with each other. And so can I ask Abigail, if you're there, can I ask you to come on and try your hand at finishing the sentence? The public health model informs my work because it, what?
I don't know. I feel like the public health model like informs the work because it's like kind of like a guide almost, but like it also just kind of like, I don't know. I'm still new to all of this, so I might be like really wrong.
You're doing fantastic.
But like I think it's like, I don't know. Like I do a lot with like teenagers and like high schools and stuff. So it's kind of like using the public health model kind of like resembles like how we think like stuff should change, but like going through like my high schoolers, they kind of come up with like new ideas. So it's kind of like interesting to like see their brains working, because like I just kind of encourage them to like do what they think is best for like prevention. Like with my prevention background and domestic violence is a little different than substance abuse I've been learning, but yeah, so yeah, that makes any sense.
I said it's
sorry.
No, you did fantastic. Thank you. Go ahead, Dave.
What she said, it really, I was hoping what someone would say, how it guides our work. And when she talks about asking the young people what they feel, what you're really asking them about, and again, using our language, about what do they see in their environment that they want to change. And this public health approach guides us for that, because it says, let's look at the environment. And do we change individuals through education? Do we change the environment through where the agent comes in? Do we change the environment where youth are exposed to the different drugs? So it's really about guiding. It guides us.
Yeah, and I think that's pretty interesting because like my one school, they're like an overachieving school, has probably 50 kids in their club, which is amazing, to be completely honest. And they like been focusing a lot more on mental health and how like they're seeing mental health as a bigger pool than our substance abuse stuff, but it's kind of like just still tying in the substance abuse access to mental health and just encouraging them to keep going with suicidality and how they can fix that, but encouraging the substance abuse model incorporated with it. So
yeah, thank you.
I love it. They're looking at how their environment and the drugs in their environment affects their mental health. That's using the public health approach where the agent, the host, and the environment are coming together. And our strategies will be, how do we change that? And it's going to be both individual and environmental strategies. I love it. I love it. Thank you, Abigail. So again, the whole point of, again, from our previous sessions where we're talking about planning and evaluation, it's really how we change where the agent, the host, and the environment come together. And the theme for today, which I think you've noticed, is through both individual and environmental strategies to change that intersection of that agent, the host, and the environment.
Hey, Dave, as we go forward, and this is actually probably a good segue as we go into talking about the different types of prevention strategies, I wanted to see if you had a response for Dion's question, saying, going back to your example of the mandates, when the mandates lifted, how does that change the environmental strategy?
Well, I'll ask the group, what happened in your communities when, I think you're talking about the masking mandate.
As one,
That changed. Did people follow the policy? Again, when it became voluntary, whether you're not wearing a mask, what happened?
People stopped wearing masks where I live.
And so it became more of an individual approach. So it's getting back to, I'm going to go all the way back here, excuse me for this, but it's going back here. When we lifted the mask mandate, the institutions changes and our policies changed because they stopped requiring, again, whether it's in a store or whether it's at an airport or on an airplane, those changed what was required of us as a community. And so when that changed and it became an individual decision whether to wear a mask, that allowed more people to not wear a mask. So again, that was an environmental strategy that, again, exposed more people to COVID because it wasn't required anymore. So again, but that's a good example, thank you, Dion, of how policies change people's behavior. But these are all about what guides people's behavior is what we're talking about. So just when we get into some definitions about strategies, there are individual strategies, and you think about individual strategies, think knowledge, attitude, skills. What are we doing to give people information so they can make healthy decisions? What are we doing so we can change people's attitudes and inform their perceptions and give them skills? So you think about parenting classes, when you think about school curriculum, when you think about signage for people or flyers we're handing out or resource guides we're handing out. Those are all targeting individuals because they're think knowledge, attitudes, perception, and skills. What are we doing to support individuals? When we talk about environmental, we're talking about that broader physical, social, cultural, institutional forces that guide behavior. So when we change the laws around wearing masks, that changes it for everybody, and that forces the behavior change for everybody. So think about, we'll go through examples of these. So we talk about individual strategies, and the best example I have, and I would ask, how many of you, and we may have used this before, but how many of you drive a car? Those of you that are on screen, raise your hand. And how many of you, when you drive the car, you typically know what the speed limit is whenever you're driving? And then, so that's knowledge. So you have knowledge of it. And how many of you may still, and again, we are taping this, but we won't turn it in to the law enforcement, but how many of you may exceed the speed limit, even if you know what the speed limit is? Thank you, Caitlin, for being honest with me. But that's the point, is we have knowledge of what is the speed limit, yet we still may exceed the speed limit. What's going to change our behaviors? Even though we have knowledge, we've been provided that information, what's going to change our behaviors speeding in a specific area? So this is where the agent, the host, environment come together. Think about a street where you may tend to exceed the speed limit. What's going to change that behavior?
Being a cop sitting there on the regular or getting a ticket.
Law enforcement getting a ticket. You see a cop car or a police car there, that's going to change your behavior. We can put in a speed bump. That's an environmental strategy. That's going to change our behavior. We can put in roundabouts. We can put in stop signs that change behavior. Again, the stop sign, if that's not enforced, which can be enforced in two ways. One, if a law enforcement there and they give you a ticket, or if you drive through a stop sign and you get into a crash, that's going to change your behavior as well. So there are ways knowledge alone doesn't necessarily change behavior. We need knowledge and environmental strategies to change behavior. Learning about that car accidents. Thank you, Dana. When you do get a ticket and you can go to what's it called, the classes to get the ticket off your record, that's where they show you what are the consequences, and they really drive home what are the consequences of exceeding the speed limit or driving through red lights or stop signs. All those change behavior. So think about strategies. What does it take to change behavior for individuals? And then what does it take to change behavior for everybody within a community? That's when we start talking about environmental strategies. And just incidentally, if you're ever driving into the Portland airport, they always have a police car, and I think they even leave the engine on and the lights on, but there's nobody in the car. It's just people slow down when they drive up, and they put it at different places at the airport, but that car is always there, and people always do slow down when they see that car. That's an environmental strategy. If it's their policy that they're doing that, and they'll always have that car there, that's changing the environment for everybody in that particular environment. So when we talk about individual strategies, they're on targeted individuals or groups of individuals, e.g. a class or families, that intended to change the knowledge, attitude, and skills of individuals within that population. So when we talk about individual strategies, they tend to focus on individual strategies. We're providing a parenting class. We're providing a 5th grade curriculum. We're providing these brochures and making them available to the public. They tend to be provided to individuals or groups. We're trying to reach all the parents of the high school students. We're trying to reach all the retailers with this information. And we can provide, if we're providing a class or to parents or a school curriculum, we can provide multiple dosage or greater dosage. Again, life skills training is, I think it's 23 sessions in a 5th grade class or whatever grade we're providing it. That's going to really cement the knowledge, attitude, and skills we're trying to bring to that population. If it's a parenting class, or if it's an after-school program that has curriculum associated with it, those are individual strategies that are going to have an impact on those individuals that are exposed to that particular strategy. And so if we look at some examples, we've been talking about these. The good behavior game occurs in the school setting. That's a strategy where you're impacting not only the teachers, you're impacting the school staff, the administration, the playground monitors, the bus drivers. It impacts everybody within the school and the youth. We can talk about life skills training, big brothers, big sisters. These are all individual focused strategies that are impacting the knowledge, skills, attitudes of individuals. Any questions about what is an individual focused strategy? When we start talking about, and if you have any other examples of your individual strategies, please go ahead and share. But again, this is where we're interacting with individuals. And so when we talk about environmental strategies, again, going back to our definition, here's where addressing the policies, procedures, systems, norms, expectations, regulations, conditions, and enforcement of a shared community environment. There's a lot packed into this, but one of the key terms is that shared community environment. When we're impacting everybody within the environment through the change, through the procedures, the systems, et cetera, the policies, then we're talking about environmental strategies. And so when we talk about environmental strategies, we have a greater reach. So we're reaching entire populations within a community through those policies, through those strategies. When a law is put in place, when a policy is put in place, it has a longer duration. So we know that, again, think about the speeding. If the stop sign is put there or the speed limit is lowered and we're enforcing it, and we put law enforcement resources, whether it's through parking a police car there or putting up a radar with the photography, whatever it is, that environmental strategy occurs on an ongoing basis for longer in duration, and it shows rapid results. If I drive through the stop sign, I may get in a crash. That's a quick result. If I drive over the speed bump too fast, it's going to damage my car. That's a longer result. Or if I get a ticket, that's a fast result. When I get the ticket, that's going to change my behavior. So this is what the definition of environmental strategy, reaching the entire population over the long term. And so these are just some examples. And this gets to the heart of Dana's question. Here's where we see that different, again, restricting alcohol at community events. So if we require at our county fair or at our at a Thursday night wine festival downtown, if we require everybody to show their ID and they have to wear a wristband, and that becomes policy. If we decrease the size of the drinks at the county fair, if we put a rope around where the drinking occurs, and we only let people in with their IDs, that changes it for everybody at that particular event. That may be the events policy, or it may be, if it's on public lands, the public policy. Require permit for alcohol at city events, and school policies on vaping use. These are all examples of environmental strategies. Now, getting into the gray area where we have, again, a drug take-back campaign. Some people will say, well, if we're only doing it at one location and it occurs randomly, some people will say that's not really environmental strategy. However, if we think about a drug take-back campaign, if pharmacies and law enforcement and whoever else is doing the drug take-back, if they write it into policy that this is going to be an ongoing situation where we will take back drugs at this case, at this time, in this place, and we're going to have systems in place that allow us to secure those drugs and then take them for disposal and incineration, then that becomes an environmental strategy when it's written into policy, when it's going to occur, reach everybody in the community. It's going to occur on an ongoing basis, and we can show results there. For instance, in the drug take back, that we will always have it, and we can always show that we're taking back these drugs at these times and we're getting rid of them in these ways. So again, when we look at some things that may be occurring on a one-time basis, when we write them into policy so they occur on an ongoing basis, then they become environmental strategies. And here's where public awareness campaigns and alcohol warning signs and posters, and getting back to Dana's question, here's where I would look to the funders. Some funders classify those as environmental strategies. I can show you a list of a funder that classifies it as environmental strategy because they're reaching everybody. Others classify them as individual strategies because they're only providing information to people. They're not necessarily changing the behavior. So any sorts of these awareness campaigns or public service campaigns, I would look to different funders because they may classify them differently. By my definition, I would say a public awareness campaign or putting up flyers is an individual strategy because we're only providing information. However, if we make it a policy that we're always going to have this billboard and we're always going to fund it, and it's going to occur on an ongoing basis, then we're moving it into environmental strategy. If we're putting up warning signs in bars, well, that's just providing information. But if the bar makes it a policy that we're always going to put these up, if the local prevention organization writes a policy that we're going to provide all bars in our community with these warning signs, and we're going to allow them and train them, and that's part of our operating procedures, then we're moving it into environmental strategy because it's going to be occurring on an ongoing basis. Dana, has that started getting at some of the differences between these? Again, some of these may be individual as they're applied, but we can turn them into environmental strategies by building them into our policies and practices and procedures.
Yeah, that's helpful. I think the one I hear the most about is social norms campaign, because the environmental strategies definition, I believe it says norms within it. And so we get people saying, well, we're changing norms, so it's an environmental strategy. And to me, it still feels like you're just providing information. So that's the one where I think there's been the most kind of ambivalence about it.
Yeah, and I agree that it is just providing information. And then my response would be, if we're building that into our systems, that we're always going to be doing the surveys, we're always on an ongoing basis, we're always going to be engaging youth in coming up with what are those messages. If that's written into our policy and we're going to form a school club, then that whole process becomes an environmental strategy because it's written into policy, it will occur on an ongoing basis, and it will reach an entire population. So that policing, is that a word? Policizing
We'll
that.
we'll make it a word.
Making it a policy. Making it a policy is what makes it environmental strategy, not necessarily the campaign itself.
And if I could just add one more caveat, I think that there are kind of political truths that we're all living in and living with, and part of that is the fact that funders oftentimes are providing kind of the best information that they have at the time, and so they will put something in. And so what we want to do is move folks beyond just merely kind of checking off a box. You know, they the funding is asking for an environmental strategy, and this is on the list. And so here I've checked that box, and helping folks really understand what will actually create the impact or the effect of population level change. Now, that may or may not have anything to do with how a funder defines one thing or another. And we have to help coalitions and communities kind of understand that as they are developing things. And it's just kind of part of the context in which we're living. I'm not quite sure if that's helpful, but it's part of what it is that I found that I've had to help communities with.
Thank you, Carlton. And so you were mentioning a theme, and there is a theme that we've been going through this. And when you think about policy-based strategies, there are two ways of looking at policies. One are what we call big Ps, and these are policies that need to be put in place through the voting of an elected body. So if we're going to be asking a city to put a social host ordinance in place, or asking the school district to put a school athletic drug policy in place, where the school board needs to vote on that policy, or the city's going to be voting on creating a drug-free park and zone in the community. When it has to be voted on by an elected body, then we call that a big P. That's important because if we're going to be advocating for that, then we need to start worrying about lobbying rules, and we have to go through those formal processes. And so these are good when we can get these big P policies in place, because when a drug-free zone becomes a drug-free zone, it's in place for perpetuity until it's changed, and we can make sure that we're enforcing those drug-free zones. So that's why we want to look at those big P policies and saying, what's it going to take to get a city council or a school board or a county council to adopt these policies? That's going to require a certain level of effort. And then we can look at little P policies, and these are where organizations change their policies, practices, and procedures in a way that then it becomes an ongoing basis within that organization. So if a workplace adopts a drug-free workplace policy, and they put all the steps in place to make them a drug-free workplace, and it's written in their policy, and they continually implement that, then that's a little P policy. Law enforcement party patrols, and we talked about law enforcement going into the bars at certain times. If they write that into their patrol practices, if they put the funding behind it to make sure they have the resources in place to put those in place, and they provide training on that on an ongoing basis, that whole process makes it an environmental small P policy, because an organization's adopting it. A retailer policy that they're going to provide responsible beverage server training to every time they hire a new staff, and they have resources dedicated to that, then that's a small P policy that we're putting in place. So we can look at, when we start developing strategies to address, going back to our public health approach, where the agent, the host, and the environment come together, we want to be looking at, are there big P policies? Are there little P policies that we can put in place? Are there any questions about this? And this is just another way to just be aware that as an organization, whether we're a coalition, then if we are funded by federal dollars or state dollars, that we don't violate any lobbying rules when we start looking at impacting those big P policies and getting those in place. We just want to be aware of any lobbying rules that may be affecting us. So just the way some of these are framed, and Carlton mentioned different funders have different approaches. These are the 6 CSAP strategies that SAMHSA uses. So for the state block grant, the money that comes from SAMHSA to the states, they ask for all the strategies to be categorized as one of these strategies. And one of those strategies is environmental strategies. They have other types of categories that they allow their funding to be identified. the point is here that they do identify environmental strategies as one of the types of strategies. So when we start looking at comprehensive strategies to address where the agent, the host, and the environment come together, we can look at some, and we'll look at this, some combination of these types of strategies need to be put in place. And then the same thing goes for those of you that may have heard of the Drug-Free Community Program or gone to any CATCA trainings. When they talk about the 7 strategies, they talk about the individual focused strategies tend to be providing information, building skills of individuals. We've talked about that. Changing the environment is changing the policy, changing the physical design. We think about the speed bumps and putting in stop signs and parking a police car. That changes that physical design of the environment, moving tobacco products behind the counter. That changed the physical design of the environment. So we can look at whether it's through the comprehensive strategies, we need to do all of these to change and impact where the agent, the host, and the environment come together. So I'm just looking as a situational way of applying all this. If parents are hosting graduation parties with alcohol, what are some individual strategies we could put in place? If they're hosting them in the home, what are some individual strategies? If we know that, say, I'd rather have the kids drink at my house, they're 18, they're graduating from high school, they're going on becoming adults, what are some individual strategies we could put in place? With letters home to share information, right? So school can provide letters home to the parents around graduation time. Thank you, Dana. Right, we can offer mocktails as an alternative. We can try to get information to parents. Hey, it's okay to have parties. We want to celebrate graduation. Just don't provide alcohol. You can provide these types of drinks that simulate it, but doesn't provide the alcohol. We can have after prom parties. That's an individual strategy. We're providing an alternative strategy rather than going home. A safe place for people to go after prom. These are all individual strategies. What might be some environmental strategies that we could put in place? So think about what policies we could in place that impact this situation. A social, thank you, Dana, social host ordinance that empowers police to go when there are big parties to go and hold the host, the parents who are holding the parties responsible and liable for the underage drinking that's occurring there. I've seen some school districts change their school policy. So now we're going to require breathalyzers to get into the prom. We're going to laws and enforcement laws, thank you, Esther, that prohibit underage drinking. So we're going to have law enforcement at the prom. Or if we know where the parties are, we're going to have law enforcement at those patrols. That would be associated with the social host law. I've seen some, this would be a little P policy. Some schools have made it a requirement for before the parents can get the cap and gown for graduation. The parents have to attend a training or show that they've viewed a webinar that talks about the dangers of underage drinking and providing prom, after prom parties. So that would be a small P of the school district put in place for everybody before they get their cap and gown to attend these training sessions. So again, and when you think about it, it's going to be a combination of all these strategies that impact the behavior of parents hosting graduation parties. So again, the whole point here, we want to think both individual and environmental strategies. And just as a quick reminder, when we talked about the social ecological model, some people like to frame their strategies around this, where we talked about the spheres of influence and how we can influence individuals and environments, going from the individual to the family, to the neighborhood, to school, and to the broader community. And when you think about it, just in general, when we impact the individuals and microsystems, we tend to do that through individual strategies. When we start changing those larger systems, then we're talking about environmental strategies. And Dion just created a multiple set of comprehensive strategies to address. Have the school district send emails to all parents, state the policy and the penalties. That's providing information. providing a lot of information building up to it. And when we make it part of school policy that we're going to do these things, then we're talking about making these environmental strategies. Excellent, excellent. What we want to do now, we got about a half an hour left. What we want to do is this is going to be a bit of a review from our planning and evaluation section. But basically, the whole point here in this next section is to say there are lots of strategies we can put in place, both individual and environmental. When we use this thing that we call the strategic prevention framework, then we're able to identify where that agent, host, and the environment come together and identify a combination of comprehensive individual and environmental strategies. So if you remember the strategic prevention framework, and we talked about, again, walking through these steps, and we start with assessment, and then we develop a logic model, which is really just our roadmap that says these are what is happening in our community. When we have these in place, then we can develop our individual and environmental strategies. So again, if you think about our problem, if you think about, again, from our previous sessions, what we're doing, it's like an ogre, we're peeling back the layers of a problem. So if our problem is underage drinking, we can say, but why does that occur? Well, it's because there's retail availability. Retailers are selling their alcohol to minors. And why does that retail availability look like? It's retailers are selling. We had 37% of our 10th graders report they're buying from retailers, and 38% of our retailers failed compliance checks. So we know we have a situation when we know that this is where the agent, the host, and the environment coming together. Youth are getting their alcohol from retailers. Then we can identify, okay, we need to address retailers. We need to address the date or the alcohol beverage control, law enforcement. Then we can put a range of strategies into place. We can do public education. We can change our policies around how we do compliance checks. We can require RBST, responsible beverage server training, and we can make it a law requiring responsible beverage server training. If people fail a compliance check, then they have to have mandated. And when they get their license renewal, we can require responsible beverage server training as part of that renewal process. So it's a combination of individual strategies, the education, and environmental strategies to change this one local condition.
Dave, could you expand just a little bit on the fourth question and why it's important to ask that question when we're doing these logic models? Why this population?
Why this population really allows us to say who is going to be impacted and who can impact this situation. So when we start talking about what is our role, if we're an organization or if we're a coalition or if we're a funder, we can make sure that we have all the players at the table who can impact that environment. So we don't just look at, okay, it's just the retailers. If we as a coalition or an organization, we will only have certain impact on those retailers. But when we bring in the beverage control, when we bring in law enforcement, when we bring in citizens groups, then we can have a broader impact on the particular, again, situation where the agent, the host, and the environment come together.
So you're thinking about not only what needs to be done, but who can help us implement it.
Yeah. Yeah, so it's not on any one organization to do this set of comprehensive strategies. And here's just another example of using the 7 strategies. Again, we can provide information, we can provide skills to the retailers, we can pass a local ordinance, we can provide signage, we can do tiered sanctions, meaning that there's a graduated penalties. The more you fail a compliance check, you'll eventually lose your license. We can require point of sale software and signage where at the checkout so people can check IDs and they know what to be able to spot fake IDs. It's going to be a range of strategies. The whole point of this is not individual or environmental, it's both. It's going to be a range of strategies to impact a given situation. And so just another example is if we're unpacking a problem, if it's prescription drug misuse that we want to address, and we know that it's availability of prescription drugs, but in this case, the availability is teens prescribed medications for sports injuries. So again, we have a football player or a soccer player or a gymnast who has been injured and they go to the doctor and they get some prescription pain medication. And what's happened is they're sharing their pain medications with their friends, with others. And so we want to stop that availability. I'm going to ask, what are some individual and environmental strategies we could put in place for that? And going back to our previous example, Linda talked about just engaging broad populations in understanding the problem. So again, taking what Dr. Hackett said about the previous situation, we can engage who are the people we need to engage? We need to engage the coaches. We need to engage the school nurses. We need to engage the doctors who are prescribing the medications. We need to engage the parents who need to be monitoring this. We need to engage the young people, the athletes themselves. So there's a whole range of information that we can gather to say who needs to be involved in this, and then we can put strategies in place. What might be an example of individual and or environmental strategies if we know that teens prescribed medications are sharing them with their friends?
Educate parents.
Educate parents, yeah. And again, it's about monitoring again, parents may not know that they can count, they can be the ones giving out the medication. Or if it's the school policy that if they're bringing the medication to school, they have to bring the medication to the school nurse, then make sure the parents know that. Don't just give your medication to the young people, to your child. Make sure it gets to the school nurse so they can give them their medication during the school day. Providing information and resources to safely ease and dispose of the med. Again, a lot of the situations, the youth may only use 3 or 4 and they have this prescription of 20. What do they do with that? Do they share with their friends or do the parents work with them on disposing it? And we've seen the same situation. Again, IS request pain medication that is non-narcotic. Thank you, Dion. This is going back to the doctors and their prescribing practices. Are there things we can do? And we can make that a small P policy. Doctors are going to review their policy practices or an organization or a clinic can adopt policies that say, we're going to go through these types of non-opioid pain practices, pain medication practices. The whole point is it's a combination of both individual and environmental strategies. Again, we can make it policies that the coaches have to go through training so they can spot these practices of youth sharing. They can help monitor their athletes' recovery and how they're using pain management in that recovery. And right, so we have to be aware of the privacy practices around that. But again, that's how, again, when we engage institutions, they have policies in place that do protect confidentiality and HIPAA. So I think, Carlton, you were mentioning a theme. One theme is environmental strategies are policy-based. The other theme is when we address local conditions where the agent, the host, and the environment come together, it's going to be both individual and environmental strategies. And just to let you know, there are, again, and we're going to share just in a second, share some resources with you. If you look at some of the guides around environmental or strategies to address this situation where youth are sharing their prescription drugs, there are evidence-based strategies around that. Again, presentations on prescribing practices, what Dion mentioned. We can look at prescription drug monitoring system to see there may be doctors that are over-prescribing. There is media campaigns, there's school curriculum, family-based interventions. This is from a SAMHSA document on strategies to prevent non-medical use of prescription drugs, but there's a range of individual and environmental strategies that have been shown to address this particular situation of teens sharing their prescription drugs. The whole point is, in a lot of these situations, we don't have to make up the strategies. There's already evidence-based strategies that can inform us about what we can do to address, you're getting sick of hearing me say this, that situation where the agent, the host, and the environment come together. So just as a little test, if we can, a chat box poll. Which of these are environmental strategies? And list all that apply. A, adopt the teen party ordinance. B, implement campaign or awareness within a school district. Reinstate or maintain Friday classes to shorten the elongated weekend. That's a college practice to try to address parties on Thursday night when they have tests and classes on Friday. Restrict alcohol on public property. Hang posters that warn of the dangers of underage drinking. Which of these are environmental strategies? And there are no wrong answers here.
But that implies that they're all right.
So D and E, restrict alcohol on public property, hang posters that warn of dangers of underage drinking. B, D, and E, implement a awareness campaign. A and C. So basically I'm saying A, B, C, D, and E. All of these could be an environmental strategy. Adopt the teen policy ordinance. That's clearly an environmental strategy, meaning we're giving law enforcement the ability to impact young people under 21 who are drinking. And if there's large parties, it gives law enforcement the ability to intercede in those large parties. Implement a policy campaign within a school district. If that's written into their school policy that they're going to do this campaign and they're going to put funding by it and they're going to embed it with the school survey and that's part of their school policy, then that could become part of a environmental strategy. Reinstitute and maintain Friday classes to shorten or the elongated weekend. That would be a school policy, a college policy. It may be a small p. They don't need to go to the board of regents to get that in place, but we're going to adopt a policy that classes have to meet on Friday. The school restrict alcohol on public property. That would be an environmental policy, whether it's at parks or at different places that we're identifying it. And hanging posters that warn, when we build that in as part of our policy, that's we're going to hang these posters on an ongoing basis and we're going to provide funding for that, then it can become part of an environmental strategy. So what we've talked about in our last bit here is there is an evidence base. I'm going to say this, Carlton and I have been around long enough. I don't know if any of you have, where when we first started, at one point I started in 1990 looking at this, there were only 8 evidence-based strategies, meaning there had only been research done on 8 evidence-based strategies. Now we have hundreds of evidence-based and we have hundreds of evidence-based environmental strategies. So when we talk about evidence-based strategies, and these are great because there's resources for us and lots of resources available. And I'm going to put this in the chat box if I can. Just get it here, my desktop. So I'm putting in the chat box a list of resources that cover everything we've talked about, but it provides link to all these resources that I'm going to share. And a strategy becomes evidence-based when there's a research design, meaning they've got a control and experimental group. They're able to say this strategy has made a difference and we've demonstrated it. Internal validity, it's based on an internal logic model. If we do these things, we'll have these results. Independent validation, meaning the strategy has been put in place in multiple settings by multiple people implementing those strategies, and it's been shown to work in diverse populations. Then it can start to show up in some of these resource guides. And so when we look at that, there's lots of agencies and organizations that provide these resources. What we want to do for the next just 3 or 4 minutes is just share some of these guides and share with you how they provide the information about evidence-based, especially around looking at how they identify what are environmental strategies and how they identify what are evidence-based strategies. So again, this is a guide from North Carolina, and this is in the list here, but it provides, it's the latest one, just April 2022. Just to show you an example, they provide evidence-based strategies for environmental strategies, for individual strategies, and a whole range of strategies, and they break it out by substances, and they break it out by what is the target of those different strategies. Then they break it down to say, what is the description? Then they provide, again, detailed descriptions about how you can go ahead and implement the strategies. So the North Carolina guide is and important guide. There's also a guide from tobacco products. This is from the Center for Disease Control. They provide strategies around tobacco. So there's, if you're dealing with the tobacco issue in your community, the CDC provides guides. Again, this is from Washington State. They provide evidence-based strategies around marijuana, and they provide promising programs, meaning some research has been done. They haven't been demonstrated in multiple settings yet. And then there are environmental strategies that are promising. So this is around marijuana from Washington State. Vermont provides a list of strategies for alcohol, and they list them by risk factor. So you can look, if we're addressing availability or we're addressing normative beliefs, we can go look at what strategies have been shown to be affected by risk factors. Again, this is from SAMHSA. They provide 33 evidence-based strategies to address prescription drugs. Then they provide a range of information around what is it that made this strategy effective. So we can use this to guide our strategies. Again, there's from SAMHSA for 18 to 25-year-olds, what are strategies that have been shown to be effective for those? And they identified by drugs for alcohol, for marijuana, tobacco, prescription drug. Again, there's not a lot of information around strategies for 18 to 25-year-olds. SAMHSA provides strategies. Again, SAMHSA provides, this is from the Center for Disease Control, around overdose prevention. So how do we prevent overdose? What are strategies we can put in place? The whole point is, there are, depending on what is the agent, what is the host in the environment, there is lots of information about strategies that we can put in place. And so again, I'm just going to turn over to Carlton here to just bring this all together. The whole point we want to talk about today is we want to be able to look at what is that agent, host, and the environment, where they come together, what are combination of individual and environmental strategies that'll impact that situation. And yes, there are evidence-based strategies that we can use to guide us. With that, I can turn to bring us home here.
You brought that plane in. You came in hot. You came in hot, but you landed that bad boy. Thank you so very, very much, Dave. And thank you all. Everyone, if you wouldn't mind, those of you who are willing to come on screen, please do. In these last couple of moments that we have, I just want to make sure that we touched on the various things that we told you we touch on. And if you have any questions, in the chat, I placed the link for our evaluation. If you don't mind, please, it is very needful for us to be able to provide the state with that evaluation report. But I wanted to give the remainder of the time to you all. And so what I'm going to do is really, really quickly kind of go through any thoughts, any closing thoughts, any closing questions. And I'm going to start off, if you don't mind. This is not meant to embarrass anyone, but I'm start off with Dana. If I can have a closing thought or idea, or you can just say, I pass, thank you very much.
I thought this was really informative. The thing that I've struggled with a lot is things that are sometimes environmental strategies at one level, but not at another level, and where that cutoff was. And I think Mr. Shavel did a really good job of explaining where that cutoff is and how it can be both. So thank you. That was a great presentation.
I appreciate that. Thank you very, very much. Dr. Hackett, what any closing thought, idea, or question that you might have? Or you can say pass. Thank you very much.
This has emboldened me to say that, remember when asbestos was not known about in different things, you cannot be helped if you don't know. We can sit here and talk about a specimen, but if the people that are involved at the grassroots do not have this type of information, it cannot have the impact on their lives. We talk about mental issues and those type of things that are going on. Sometimes people feel so isolated and alone. This type of data has to get into the communities on a personal way. You know, it's like everyone else is making decisions for you, but you really don't know what's going on in your space. Like if you live in a community, I'm sorry to talk so long, you don't know what the data is about how many murders, how many break-ins, how many whatever's going on. You should have a right to know. unfortunately, I think even some of the schools don't want the information in for fear that it will hurt some of the students, but it's hurting some students because they don't know. Thank you.
You brought up some really remarkable points. I think one of the major things is that as we're looking at how we can have the greatest effect and impact to create population level change, Dave mentioned a couple of things that were part of the formula. We have to think about policy. We have to think about making sure that we're applying those resources to those policies and that we're enforcing. But you also bringing up the fact that we also have to have inclusion in our decision making, in our processing of all of this, because without the inclusion of the communities that we're trying to help and support, we're not going to achieve those population level outcomes.
Exactly.
So thank you very, very much. Dave?
Another thing that it brings up, what you're talking about is before we get to some environmental strategies, what Dr. Hackett is saying, we need to provide those individual information just so people are aware of what's happening before we move to policy. They won't be able to support a social host law if they don't know what's the situation that's occurring, that the social host law is needed. So thank you for that. That's that combination of both that we need to have in place. And we need to start with, this individual information sharing.
Really great point, Dave, because we often get into this kind of dichotomy of thinking of, it's either or, like environmental strategy, good, individual strategies, bad. And that's not the case. We need both to be able to achieve the kind of changes that are necessary. So it almost doesn't matter as much as with the defining of it is our understanding of how we're applying it. And you said that consistently, Dave. Thank you for that. And with that, I'm going to provide the last words to Christine. Christine, thank you so much for your leadership in helping us to organize this and pull this together. Thank you for the leadership provided at the state and the support that you're providing to everyone. Thank you. I want to pass the mic to you and give you the closing word. Dave, thank you very, very much. If we can all give Dave a round of applause. Thank you for leading us through a great week.
I think final words, and I said this to our presenters this morning, for somebody who has absolutely no prevention background, these classes are so vital and so important and so knowledgeable for me so that I can learn what you all are doing on a day-to-day basis. Moving forward, if you have somebody new to your organization that needs the other links to the YouTube past sessions, please reach out to me. I will send you that information. We have the next training on the 22nd, which will be a thankful Thanksgiving type of atmosphere. And we look really forward to having you guys, participate and continue to provide the great services that you are providing in the state of Delaware to our youth. So thank you very much.
Thank you all very much. And we will be providing all the resources that Dave mentioned. We'll be providing that to you all. And so look for that email. Thank you all so very, very much. And looking forward to seeing you all next time. Take care.
Enjoy the weather.
Thank you. You all too.
Bye-bye.
Thank you.